Everyone. Thank you for joining the Spina Bifida Association's Community Information Session, Navigating Employment and Benefits at Age 18. This session will include insights about finding adult physicians, benefits after age 18 or after leaving your pediatric clinic, financial planning, vocational rehab and employment, and home and community waivers. My name is Judy Thibodeau, and I'm a member of SBA's staff. For this session, I am joined by my colleague, Juanita Panliner, SBA's National Resource Manager. I want to mention a few things before we get started. You will remain muted throughout the session. We welcome your questions via the Q&A and chat features, time allowing. You will receive a link to the recording. The recording will also be on SBA's YouTube channel. Closed captioning is enabled. Please complete the feedback form, the evaluation, when you receive it with the recording. Now I'm pleased to introduce today's speaker. Shannon Bevans is a licensed clinical social worker. She's a Spina Bifida adult transition care coordinator and an outpatient social worker at Orlando Health in Orlando, Florida. Welcome to you in the community and to Shannon tonight.
Well, thank you so much, Judy. Yes, my name is Shannon Bevans, and I am the Adult Transition Care Coordinator for the Spina Bifida program at Arnold Palmer Hospital for Children. And my job is literally to help youth and young adults transition from pediatric to adult-centered care and help them to achieve independence. And so tonight, I thought that I would just go through sort of what I tell my patients and the most important things that I tell my patients once they reach age 18, and specifically as it relates to benefits and navigation for adult healthcare. And so I apologize that this is going to be very content heavy. There's really not any way for me to avoid that. So if you want to take a pen and paper or take notes, you're welcome to do that. Or of course, we will have this posted afterwards. And just know that you don't have to get everything during this webinar. This is just kind of an overview. I am going to be talking about some benefits like vocational rehab and Social Security. And I know that those things have already been discussed in detail in previous webinars. So I won't be going into too much detail in all of these. It's just kind of an overview as to all of them and kind of how they come together once you turn 18. So with that, you're aging out of the pediatric Spina Bifida clinic, and now what? So you're a legal adult, you have insurance changes, you're transferring to adult providers, you have disability redeterminations for SSI and, insurance and things like that. You're looking into employment and post-secondary education, and you're looking to live independently if that's possible. And I will say that the most common question I get from my patients is about insurance, and rightfully so, because it's a very complicated issue. But these are just some things that people really think about when they're leaving the clinic, and we're going to talk about some of those tonight. So some transition tips that I tell all of my patients. These are things that I tell all of my patients. So I want you to be able to gain a general understanding of how supplemental security income works, or SSI, at the age of 18. I know that before the age of 18, you might have been receiving a benefit, and it might have been under your parents, but understand that once you turn 18 or 21, there's going to be a redetermination process. And so to be mindful of that, you might get a letter from Social Security saying that, they're going to do a redetermination. Understanding insurance changes. So insurance will change. I know that like here in Florida, patients are on Children's Medical Services. And then once they hit 21, then they transition to, straight Medicaid. So to be mindful of the insurance changes. And understanding how working affects benefits. And this is something that we will talk about later on, but if you're receiving SSI or SSDI, there are income limits to that. So if you work, if you're earning, that can affect your benefits. And so please be mindful of that. And to also learn about home and community-based service waivers, and each state is different. Home and community-based service waivers are essentially an extension of Medicaid coverage to help individuals with disabilities remain in their homes and to not live in nursing homes. And those services and those waivers are distributed differently from state to state, but to just please be mindful of what your HCBS waivers are in your state. And to learn self-management skills early, utilizing the Transition Readiness Assessment or the Track SB to gain self-management skills early. And what do I mean by that? Learning how to fill your own prescriptions, learning how to use an electronic medical record like MyChart, being able to talk to a doctor and explain to a doctor what it is that's going on in your body. And, activities of daily living, cooking, dressing, all of those things, like make sure that you are learning those things early. We don't want to gain those skills. We don't want to start learning those things right at 18. And the other thing is to volunteer. And I tell my patients this all the time. Volunteering is absolutely one of the best ways that you can learn what things you're good at and what things you're not good at, and what things that you like and things that you don't like. And there's no harm, no foul if you don't like it, because it's just a volunteer position. And so this is a great time to explore and learn about those things. And volunteering is just a really, really good way to do that. So I highly recommend that you start volunteer work in high school, or well before you age out of the clinic. And then beginning youth employment programs in high school, such as vocational rehab. We will talk about those later on, but to get involved in those programs early. So like high school, a lot of VR vocational rehab programs start in high school. And so I always say get involved with those early. So we're going to talk about employment and post-secondary education. And when I mean post-secondary education, I mean anything of education outside or after high school. So that could be college, that could be a trade school, things like that. Before I do that, I wanted to just throw some statistics at you. The Office for Disability and Employment Policy, which is funded out of the Department of Labor, every year they issue disability employment statistics. And I just thought that it was worth noting that, so the employment to population ratio for people with disabilities ages 16 to 64 is 38%. People without disabilities age 16 to 64 is 75%. The unemployment rate for people with disabilities is 8.5%. People without disabilities is 4.2%. And the labor force participation rate for people with disabilities ages 16 to 64 is 40.7%. And people without disabilities is age 16 to 64, or ages 16 to 64 is 77.7%. And what does this mean? So this means that there's an employment gap. There is a significant gap between employment rates of people with and without disabilities. People who are not disabled are 3 times more likely to be employed than people who are disabled. And there are reasons for that, but hopefully we can talk about some of the programs that are available to you so that we can reduce that number. So some employment services. There are many, many organizations that help people become employed, and each state is a little bit different, but Division of Vocational Rehabilitation is absolutely wonderful, and that is federal. It's just a matter of how your state distributes it or how they work it, but each state should have their own Division of Vocational Rehabilitation office. The Workforce Innovation and Opportunity Act, or WIOA, which we'll talk about later. WIPA, which is also a form with Social Security. Ticket to Work, and state-specific disability employment agencies. And you can always look at the Office of Disability and Employment Policy, which is funded out of the U.S. Department of Labor, that can give you all of the up-to-date statistics and information on your state-specific disability employment rates. As I said earlier, working and keeping benefits. So you need to understand that both SSI and SSDI have income limits. The eligibility and benefit amount can be affected by how much you have and how much you owe, or how much you own. So if you have assets, or if you make a certain amount of money, just understand that those benefits can be impacted. They use countable income and resources, and if those exceed those limits, they can be reduced or revoked. The Ticket to Work program and the vocational rehab can help you maintain this employment with what we call work incentive programs that can help you to work and still maintain your benefits. Again, that is through vocational rehab. So I highly recommend that you reach out to them. You can also check the Social Security website, or it's called the Red Book. We refer to it to the Red Book, but it has all of the information about how much money you can earn versus while staying on your benefits. It has age restrictions. It's a really good resource. So you can check their website, or you can consult the Red Book, which I do believe is online as well. Understanding substantial gainful activity, or SGA. So this is essentially how much an individual can earn without their benefits being impacted. So please be mindful of what SGA is, and you can get that information through you can do it through from vocational rehab, but you can also get it off of Social Security. So please just be mindful of that. Talking about vocational rehabilitation, this helps people with disabilities prepare for, find, and maintain employment, and provides individualized services like counseling and training so that people with disabilities can become employed. Examples of what VR can assist with include assessment, counseling and guidance, training, job placement, tuition assistance for college or vocational schools, books and supplies, assistive technology devices, transportation services, occupational licenses, vehicle modifications, psychological counseling, medical services, job placement assistance, and vocational training. So VR can do a lot for you. And you just need to get enrolled as early as you can. And I don't know exactly the exact age limit for each state, but I know that like here in Florida, it's age 16. And with the vocational rehab, we want to talk about the work incentives and planning and assistance, or WIPA, which is a program that serves beneficiaries who are already receiving benefits. So like SSI, who are wanting to start work and are ready to start work. And they assist beneficiaries by providing information about programs and availability of work supports. They also provide individualized information about how, about the effect of work in your health insurance. They can provide in-depth counseling about benefits and discuss the effect of work on those benefits. So it's individualized counseling. And so if you are on Social Security and you do have a VR office, I would recommend that you look into WIPA services. Ticket to Work program. So this one is kind of near and dear to my heart because I am a recipient of the Ticket to Work program. I would not be sitting here talking to all of you, or have this job, or have my bachelor's or my master's degree without this program. It is a program with the Social Security Administration And it's geared to support people who are aged 18 to 64 who receive Social Security benefits who want to work. They assist beneficiaries to achieve their financial independence through employment services and work incentives. So you might be receiving Social Security, and you say you have an employment goal. And so what they will do is they will set up like job opportunities for you and potentially help you like pay for schooling. So like I'm not saying this for everybody, but they paid for my school with the understanding through Ticket to Work that I would eventually get a job. So they paid for my vocational rehab, paid for my school through this program with the understanding that I would be employed, basically. And so it's a really good program because it connects beneficiaries with free employment services, career counseling, job placement, training, and ongoing support. So again, it's a really good program, and not everybody, it doesn't work for everybody. So I will say that for Ticket to Work, it is very much an effort that you have to put into it. So it's not like they just come and say, hey, we're going to help fund this training for you. You have to put in the work. You have to make sure that you are setting up job interviews, making sure that you are doing well in your classes, whatever job training that you set out for them, or that you set with them, you really have to do your part. So it is very much a two-way street type of deal. So they can help you, but you really have to help yourself. Okay, so we've talked about the VR benefits and sort of how that works on the employment side. And I couldn't not talk about what college and post-secondary, the effects that kind of has on this, because they are kind of connected. So the things that you need to know about post-secondary education, and people probably may already know this, but it is something that comes up with my patients a lot, is your IEPs do not transfer to college. Individuals with Disabilities Education Act, or IDEA, governs IEPs, which no longer apply for students after they leave high school. That does not mean, however, that colleges still have to provide you accommodations. It's just not under IDEA, and your IEP is not used as the document that protects you. So colleges have to abide by the Americans with Disabilities Act and provide accommodations under Section 504 of the Rehabilitation Act. So, even though an IEP is not really a usable document in college, so sometimes, though, I always tell patients, bring a copy of your IEP to college, like when you're going to meet with the disability resource coordinator, and give them a copy and just show them, hey, these are the things that worked for me when I was in college or when I was in high school, and so that they can formulate a plan so that you can get those accommodations in college. Requesting accommodations in college, so that is different than in high school. So you need to make an appointment with the Campus Disability Services office. Usually colleges have one of those. And as I said, bring a copy of your accommodations that you use in high school so that they can help formulate an accommodation plan for you in college. Additional testing may be required. They may ask you to take additional testing so that they can give you the appropriate accommodations that you need. And each disability services office provides accommodations a little bit differently. And one thing I will say is that it is the college student's responsibility to request the accommodations from the professor. It is not like in high school where they will come to you and say, hey, these are your accommodations, or these are the things that we think that you need. Colleges will not do that. You have to go to them and tell them what you need. So I always recommend meeting with them well before school starts, like in the summertime. And once you get your class schedule, you set up meetings with your professors and you tell them, hey, these are the things that I need for accommodations in my class. And it is also the college students' responsibility to work with the professors if your accommodations are not working. So please do not get halfway through the semester and find out that you're failing classes because you need a note taker, for example. Don't wait halfway through the semester. Like, you need to go to your professor once you realize that there's something is not working as soon as you can, and meet with them and say, hey, I'm really needing some more support. And working with your disability resources office is really important there too. Okay. So now we need to talk about understanding your benefits. So we've talked about vocational rehab, what the differences are between high school and college. And then now we're going to kind of get into the nitty-gritty of understanding benefits. And again, this is not going to be an in-depth on all of them. We would be here all night, and no one wants to sit here and listen to me talk that long. But I'm going to talk about some of the most commonly used benefits and how they work and how they go together, okay? So supplemental security income, SSI. Supplemental security disability insurance, SSDI. Medicaid, Medicare, and the home and community-based services and statewide waivers are the most commonly used benefits that I work with, okay, that I see in our clinic. And I recommend looking into these programs at like age 16 or 17 or earlier if you want to do that. So supplemental security income, SSI, is not SSDI, okay? SSI provides monthly payments to people with disabilities and older adults who have little or no income or resources. The eligibility for that is based on your income and your resources, regardless of your work history. It's funded through general tax revenues. The benefit amount is a fixed amount based on the individual's needs. And Medicaid, in many states, people who are SSI recipients automatically are eligible for Medicaid, okay? Again, check with your actual local state to see how that works, but SSI, I think SSI and Medicaid can go together. Not to be confused with SSDI. SSDI requires a work history and contributions into Social Security. You must have worked long enough, or enough quarters, they call it, to receive SSDI, okay? It's funded by taxes. The benefit amount is based on your past earnings and contributions. There's a ratio to that. I won't even begin to tell you what that is. That's a very complicated thing, but they determine that. And then Medicare, not Medicaid, but Medicare is often associated with SSDI. So after 24 months of receiving SSDI benefits, you can become eligible for Medicare. And oftentimes I hear people get Medicaid and Medicare mixed up, and please do not mix them up. They are different. So as it relates to Medicaid, as I said, it's primarily for individuals and families with low incomes, regardless of age, and those with disabilities. The costs, Medicaid programs, generally premiums and beneficiaries are no out-of-pocket costs for services, typically, okay? That's not saying for every single place. The coverage is a range of medical services, including hospital stays, doctor's visits, and some long-term care services. There are coverage variations, and they vary state to state, with some states offering additional benefits such as dental and vision care, but that's state specific. There is something called dual eligibility where people can be qualified for Medicare and Medicaid. Again, that is a specific individual case, but there are instances where you can be dual eligible. And I would say to that is, if you do think you're dual eligible, to ask your caseworker, like the Medicare or Medicaid, whoever it is that you have to say, ask them if I am dually eligible. Medicare is primarily for individuals aged 65 and older and some younger people with disabilities or end-stage renal disease. The funding is primarily through payroll taxes, premiums paid by beneficiaries, and general revenue from the federal government. It covers a wide range of services, including hospital stays, doctors, and so similar, and preventative care, so similar to Medicaid. The cost is different, again, it's individual, but beneficiaries pay a monthly premium, deductibles, and co-insurance for certain services. And there are different parts to Medicare, which is A, B, C, and D, that cover specific services. Home and community-based service waivers. You've heard me talk about that. It's important to know what HCBS waivers are available to you because it allows states to offer long-term care services in a person's home or in a community outside of an institution. So rather than like living in a nursing home, you can utilize these services to get the care that you need after you turn 18. So, having a care worker come in and help you, transfer or your medications or transportation. So it really is a service to provide services to people who would otherwise receive those services like in a nursing home. It's like I said, it's state specific. So you need to check and see how those funds are distributed and how they're utilized. And this is it's another good resource to help you to become independent. And I will say that HCBS waivers tend to have wait lists, not every place, but there are often wait lists for these services. And if that is the case, I would recommend that you, either get on that wait list or talk to a community caseworker on, what the process would be to get on that wait list, or to even see if there are wait lists. So, but just please be mindful of that. So I couldn't not have this conversation without letting, there's some legislation. So there's some disability legislation that I always want my patients to know. They don't have to be experts in it, but they have to have some general understanding because it affects their protections as workers and as people with disabilities. So the first one is the Rehabilitation Act of 1973, Section 504 of the Rehabilitation Act of 1973. And it's a national law that protects qualified individuals from discrimination from their disability. Non-discrimination requirements of the law applies to employers and other organizations that receive financial assistance from any federal agency, including the U.S. Department of Health and Human Services. These organizations include hospitals, nursing homes, health centers, human service programs, but Section 504 forbids organizations and employers from excluding or denying individuals with disabilities an equal opportunity to receive program benefits and services, or working, or receiving the services that you are legally entitled to. And then after that really is the Americans with Disabilities Act. That is, you don't have to be an expert in it. I'm certainly not, but it's a civil rights law that prohibits discrimination against individuals with disabilities in various aspects: employment, access to public services, businesses, and it ensures that people with disabilities have the same rights as everybody else. And this covers employment. right? This covers employment. And so I just tell people that this is important for you to know, because if you're getting a job, if you're going to a place of employment, you need to understand that you do have rights as a disabled person. And sometimes the employer, it's, they might not be as up to date on, what laws, what the ADA requires or whatnot, but it's good for you to be informed, right? Because if they're not informed, then you are informed. And so that what you can request and what you can ask for, and how to protect yourself. And as it relates to that, reasonable accommodations, and a reasonable accommodation is asking an employer or an educational institution what you need in order to be able to access that service or to do that job. So a reasonable accommodation request for a job might be a wheelchair accessible desk, or it might be an elevator, or it might be having excused bathroom breaks so that you can cath, right? So people oftentimes don't know that you can legally request accommodations to have timed bathroom breaks. That is a reasonable accommodation that is covered under Section 504 of the Rehab Act and the ADA. So I just share these two pieces of legislation just so that you know about them, so that you can advocate for yourself in the workspace and in the college space. Okay, so we have all of that information. So now we're going to kind of shift gears. Okay. So we've talked about the benefits side of things, the employment, and now we're going to talk about finding adult doctors. So we talked about the Medicaid and the Medicare, right? But how do you find adult doctors? So you leave the clinic and you have all these questions, and it's like, okay, well, now how do I actually find adult providers? There are some tips for finding adult doctors. Asking your pediatric doctors if they have any adult colleagues. That's always a good way to go. Search within your current healthcare system. Try to keep all of your healthcare providers within the same healthcare system if possible, or at least if they share the same electronic medical record. That's always very helpful for us so that we know we're all on the same page. Larger healthcare systems tend to have better access to specialized healthcare. And with that, larger cities often have better access to providers. And I do believe that you will be able to consult the SBA website to find adult providers. More tips for finding adult providers. Physical medicine and rehab, or PM&R doctors, can be absolutely fantastic for spina bifida specific care, for like pain management and seating, and if you needed imaging. So they're not primary care doctors, but they are really, 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 really good doctors to have as an adult, because they can do some of these very spina bifida specific things. And with that, though, I cannot stress the importance of having a good primary care physician as an adult. After you leave the clinic, that is like the number one thing. That is the first question I ask my patients is, after they leave this clinic, is, do you have a primary care physician who will see you as an adult? And are they comfortable managing spina bifida? Like, do you have a good relationship with them? Are you able to call them? Do you feel comfortable with them? Primary care physicians are like the command center for care. They should be able to, talk to specialists if they need to, or you should feel comfortable speaking to them and asking questions. And they need to understand that your baseline might look different than a patient without spina bifida, right? So like my primary care doctor knows that my baseline is not necessarily the same as everybody else's, and that she needs to consult those healthcare guidelines if something's going on, or she needs to talk to my specialist. And they must accept your health insurance. That is something that we run into sometimes, is where there might be a really great doctor for somebody, but they're not in network with the patient's health insurance. And unless that provider makes like an exception, which they can, you need to make sure that they take your health insurance. So in summary, I know that we kind of covered a lot, but you need to start learning about your benefits in high school. 18 is too late. Well, it's not too late. I recommend that you do it earlier. You start in high school. Please start in high school. Start learning these things in high school. You can work and keep benefits, but understand that there are income limitations. Please know your rights as a disabled person, because other people may not. But if you are fully informed, then that makes you a better advocate and ultimately a better employee or a better student. Insurance is complicated. I get it. I do this for a living and it's complicated. I don't expect you to be experts in insurance, but understand that insurance does change, and that Social Security changes. And I recommend at like age 17-ish. So don't wait until those changes have already happened and you're caught off guard and you don't know what benefits you have and which ones you don't. Research vocational rehab services and what age to begin those services. And to just remind everybody that you are your strongest advocate. And if you do not ask, you most likely will not receive. You have to ask for the things that you need. And it's okay if you don't understand things. It's okay to ask questions. And as a matter of fact, I highly, highly encourage that you ask questions of your doctors when you go to your Social Security appointments, when you have, insurance, benefits redeterminations, like ask questions. You will be more informed, and in turn, you will be a better advocate for yourself. And transition is a process and it takes time. It's not a single event. This is not something that we want to start doing when you are like 3 months out from turning 18. We want to be able to have done a lot of this or some of this prep work before that time, if possible. So these are my resources and sources, and I can put this in a document later, but this is literally everything that I just talked about. This is where you can access all of that information. So with that, I will end and I will take questions or feedback.
Thank you very, very much, Shannon. And we do have some questions, and I'll start out with one that was in the Q&A, and it was talking about, it says, do these programs focus on remote work? And I think it was talking about DVR. Do these programs focus on remote work for individuals whose mobility limits them from traveling to a workplace?
Yeah. So remote work is a reasonable accommodation. I know that COVID kind of threw us all for a loop and everybody does it now, but remote work is actually a reasonable accommodation for people with disabilities, and it's been that way. So yeah, they can do that, especially if you're in a job position where remote work is doable, yes, that is absolutely a possibility.
So then would you say then, speaking with the DVR counselor, then just sort of emphasizing that?
Yeah, so when you meet with a voc rehab counselor, they should ask you kind of what your goals are and what you're wanting out of employment. And they will do they will talk with you and they will do an assessment as to what is realistic for you. If you should be working in person or working at home. But they can work with you on that for sure.
Awesome, thank you. Okay, and then besides scholarship and financial aid, is there a way to get more money for college?
Well, certainly financial aid and scholarships are a good way to go. So voc rehab can help. And I say that carefully because I know that it's a case-by-case basis, but vocational rehab did financially help me get through school. And that's not to say that they're gonna help everybody with that. But it's a possibility, like it's not out of the question. So voc rehab might be able to do that. Also, you know, I don't know about every state, but I know that there are some states, like I know that in California, they've got programs like disability service organizations that help people with disabilities become independent. And they have like scholarships and they work with like local community colleges and incentive programs and things like that. So I would check into that.
Thank you. And then a person wrote that I was told not to apply for Social Security for my 18-year-old son who is going to college in the fall because it would limit his ability to work and go to college. Is that true?
Well, I mean, I won't, I can't say whether or not to not apply for Social Security or not, but maybe what they're alluding to is the fact that, you know, it can impact your ability to work, and meaning that it's income capped, right? So you can't, if you're on Social Security, there's only a certain amount of money that you can make, but that is, you absolutely can work while you're receiving those benefits. So, you know, maybe whoever gave that advice would seek more clarification as to why, and maybe look into those service programs, those work incentive programs that I was talking about, like WIPA and Ticket to Work and things like that, because those are programs that can help people remain on their benefits, but also work. So I would go back to them and just get more clarification as to what's their rationale for that, and see if you might be able to utilize some of those work incentive programs.
Here's a question that was submitted earlier, and it's I'm not sure I know the right questions to ask in terms of how much should I disclose when I am asking for accommodations? Are there things I should avoid?
Oh, that's a great question. That's a great question. So legally, you don't have to disclose anything about your disability. They don't have, and they can't ask you about your disability. Employers cannot ask you about your disability. However, it's probably smart to tell your employer about your disability, and that amount is based on the individual person. And so I say a general rule of thumb is to tell your employer what they need to know. So if you need to have timed bathroom breaks, if you need a wheelchair accessible desk, if you need modifications to your office, it's probably smart for you to tell your employer that you're a wheelchair user, or that you have a medical condition that requires you to go to the bathroom X times a day. You don't have to tell them everything, but I always tell people disclose as much of the information as the accommodations that you might need. So think about the accommodations or the support that you might need in employment, and then you can decide how much information you need to disclose. But they can't give you an accommodation unless you tell them about why you need the accommodation. So yeah, it's individual, it's up to each person, but in order to receive any type of like accommodation at work, you have to tell them about your disability, right? But if you don't need anything, it's, you know, you don't have to tell anybody.
Thank you. Can you get Social Security disability for a period of time, like while in college and cannot work and go to school? Excuse me, let me start over. Can you get Social Security disability for a period of time, like while in college and cannot go to work and go to school, and then be able to get a full-time job if possible, once done with your degree? Or will you be labeled as disabled and unable to work full-time?
Yes, you absolutely can receive benefits and go to college. I did that. And you're not going to be labeled as disabled. I mean, I wouldn't say that you'd be labeled as disabled. You have to disclose like whatever job you apply for. They sometimes will ask, you know, if you identify as a person with a disability. But you can go to school. There's also something called the student income exclusion through Social Security. So that's like if you're working, or sorry, if you're on SSI and you're in school, they will not take as much out. There's like a certain amount that's a higher amount that you can keep, basically, if you are a student. And so they want you to be able to work and to go to school. So there are definitely ways that you can go to college and still stay on Social Security.
Jumping to a slightly different topic. I'm especially interested in learning more about navigating health insurance options.
Yeah, so I mean, health insurance is complicated for everyone, but I would say to know what you're currently on, if you're on Medicaid or Medicare, or if you're through a private health insurance, and to understand that, you know, when you are an adult, your options for insurance basically are you get Medicaid, or you're on Medicaid or Medicare, which is income capped, which is, as we talked about, or you can work. And because in the United States, healthcare is tied to employment. So if you work 40 hours a week and or 35, it depends, and you're eligible for health insurance, then you can get health insurance through your employer. So your options are really through an employer, Medicaid / Medicare, you know, and you can go through like the marketplace if you want, like to buy health insurance, but it's complicated. I would just say to know what you currently have and what you're eligible for. So if you're eligible for Medicaid, for example, look into seeing, okay, well, how do I obtain that? Or if you're, eligible for, some people are eligible for Medicare, and look into that, see if you're eligible for it. But I would, whatever benefit that you're thinking about, I would go to that website, but then also talk to a case manager, talk to an actual human within those programs. So usually they have like a 1-800 number on the back, but then on the after that, they'll have like case management services. Those are really great people to talk to if you have questions about like your coverage or your eligibility.
Okay, and so those would be the case managers specifically for Medicare or Medicaid?
Yeah. Mm-hmm.
Okay. What about, I don't know if this still exists, and this is a Juanita question. Are there still navigators to help navigate the health insurance marketplace?
That's a good question. I don't know the answer to that question. I have not really utilized them very often. Like, you mean on the marketplace?
Correct.
Yeah, I'm not exactly sure about whether or not they have navigators. I know that they used to, but it's been quite some time since I've utilized them.
Okay, thank you. And then what are some questions I should be asking providers to determine their knowledge of spina bifida and related conditions? So how would you know? Yeah.
That's an interesting question, because adult providers knowing things about spina bifida this is my personal opinion. They don't necessarily have to be quote unquote experts in spina bifida. They just have to understand, they have to be knowledgeable in their field. So I don't really have a list of questions that I ask providers to kind of vet them, if you will, but I ask them, are you comfortable managing somebody with spina bifida? That's usually the more of the question that I go towards with adult providers is, do you have experience working with adults who have spina bifida, and are you comfortable managing spina bifida? But certainly if it's in a specific specialty, you want to utilize that. I've talked about the healthcare guidelines, but I don't usually go with doctors unless they're willing to at least consult those healthcare guidelines. And those have clinical recommendations and everything that is broken down by condition to age as to what is recommended to care for someone with spina bifida. And so a general rule of thumb for adult providers for me is that I need for them to at least be able to consult those guidelines. They don't have to follow them to a T, but to at least consult them.
Very good. Thank you. And I'm just reading the questions. How do individuals who graduated from high school get support with employment training? And you've mentioned some of these, but the other one was driving. So how do they get support with driving?
Well, again, that's state specific, but usually, like here in Florida, we have several places that do adaptive driving. So I usually would search for, like in Google, I would type in adaptive driving school and then your area and see what pops up, because a lot of universities do adaptive driving training. A lot of OT programs. There's a lot of occupational therapy programs that do adaptive driving schools. So your best bet would probably be to look at adaptive driving classes or adaptive driving schools in your local area. And again, you can look at occupational therapy or PT programs are a really good place to start.
Very good. And we have one more question. Are there any services available to someone with spina bifida who works full-time and has private insurance?
I'm sorry, say again?
So are there any services, and I'm not sure if by services, they might have also meant like benefits, but are there any services or benefits available to someone with spina bifida who works full-time and has private health insurance?
Oh, again, that's difficult because it's state specific. It's not a one size, at least to my knowledge. There could be somebody else who has more information than I do, but if you're working full time and you have insurance, that's a difficult one, because that throws you out of the eligibility for a lot of programs. I've learned from personal experience as a person who works full time. But, again, I would look at what HCBS waivers and what services are available through an HCBS waiver in your area, because, or like disability service organizations. So like the Center for Independent Living. There's like your local disability service organizations can sometimes like help you navigate those benefits. And I would say that to just look at your HCBS waivers and see what your state can provide, because there might be something there, but that is a difficult one for sure.